I'm Rachel Wilson, and I'm here with my friend. Do you want to introduce yourself?
Yeah, Shanisha Hoover.
And we're both therapists, and we're going to do a little video about childhood trauma. So,
Complex.
yeah, we're
topic.
just wanted to bring up a light topic today.
No biggie. Like conversation on a Monday.
Yeah, I'm curious just for you, what has your experience been like? I mean, just it could be with professionally, personally, around childhood trauma and how that shows up.
Yeah. Personally, I've had a lot of childhood trauma, ranging from early exposure to sexual abuse when I was a kid to a lot of transition in and out of homelessness, corporal punishment, a laundry list. There is something called ACEs, Adverse Childhood Experiences, and there's an accompanying assessment tool to kind of determine like where you are in terms of the severity, and I am the max. Like I check off all of those boxes. So personally, I have a lot of that experience, and so professionally, I try to utilize like my own history and allow that to kind of inform my empathy and how I show up for my clients and navigating all of that.
Yeah, thanks for sharing that. Same with me. I feel like I also have a fair amount of childhood trauma, like within my family, sexual abuse, a lot of like emotional abuse in my family.
Yeah.
But I do think it helps me to understand my clients better, because if you haven't experienced that, I feel like it's really hard to understand the complex ways that it can impact you.
Yeah, I think it allows us to kind of have like a solid anchor that kind of grounds us in the work, right? When a client tells you like you have no idea or you don't understand how dysregulating it is. It's like I may not know it to your degree, but I know it for me, right? And so what's most important is like kind of being like a light to show them like a path, like there is a path through it. And there are different interventions that we probably get into later on, but there's so many different interventions that kind of help and support like the mobility through that suffering. Because I think a lot of the way that childhood trauma can like show up in our personal lives is like it can be very stagnating, right? You feel like there's not a way forward or not a way through it. So just a reminder, like we can work through this together.
Yeah, I feel like for so much of my life, I didn't know what it felt like to feel good. You know, like it's like once you kind of get to the other side, that light you're talking about, that you've like gone through the shit for, you know, not a super clinical term, but you like moved through all of it.
Yeah.
That you don't realize there's a light on the other side, right? Like I feel like so much of the work I do with clients is like, I'm here, I can guide you through it. I know there's light on the other side, but people also, there has to be a level of trust that things can be different, because I think that it requires going through a lot of stuff to get to the light.
Yeah. I think in the stuff or the shit that we're talking about is like, what I may conceptualize is like the shadow stuff too, the unspoken, the energy in the room, or what I call the undercurrent, right? What is the undercurrent that is informing how you're showing up in your personal life or your professional life? And when you have childhood trauma, you know, the brain does a magic trick of like trying to suppress or repress these memories. But the reality is it still manifests in us in all different sorts of ways. It shows up in our dreams. It shows up in our relationships with each other, right? It shows up in critical or negative self-talk, navigating the inner critic, right? And so the way it shows up for me in my clinical work with clients is I try to find congruency in like what's being spoken and like what's the emotion behind it, or incongruency. And surprisingly, like with childhood trauma, you know, there is a lack of congruency often. So when I'm in session with clients and they're like, you know, I had to do a presentation this week and you know, I just knew it's going to be shitty. Whose voice is that? Is that your voice or is it someone else's, right? And so really exploring the roots of where that comes from, I think, is a part of the work too.
Yeah, when you were talking about the congruency, the piece of the somatic piece that's really important in the congruency, incongruency, because often when we're experiencing these events, it's before we have verbal capacity, before we have kind of this like part of our brain that does all the thinking and cognitively puts things in order and analyzes them. So a lot of that lives in our body as kind of this primordial language of sensation in our body. And often we want to try to make sense of that, even though we might not have the stories to make sense of that. And I think that's why childhood trauma can be really difficult, because we have all these feelings and emotions and our nervous system is reacting. We're seeing it show up in our relationships, in our life, but sometimes it's hard to put our finger on this thing that happened. And a lot of people don't even realize what they experienced was childhood trauma.
Oof. Yeah. And that goes back to like cultural norms, right? I think for me, coming from the African American community, like it's a cultural norm to experience corporal punishment, right? And I'm not sitting here to say like, that, I believe in one way versus the other, but I know for me, corporal punishment was not okay. Like being spanked with objects that a child should not have been spanked with, like that still has impressions on my mind to this day, right? It still impacts like my startle responses or wakes me up in, dreams and things of that nature. And so I think there's the intersection of the cultural component, right? And as providers, that's why it's essential for us to be culturally competent, right? Doing our own research, right? Because I don't want to sit here and tell a client, oh, you got spanked when you were a child, that was awful. Like, let's not normalize that. Even though we know, like, to some degree, it's not normalized to, like, abuse children. But when you think about the intersection of that with culture, it's like, yeah, how do you balance that? How do you conceptualize that for them? Yeah.
And how do you grapple with the complexity of it, right?
Yeah.
That oftentimes abuse is intergenerational. And it's like what was taught. If it's especially in our family, it's like the way that this history gets transmitted from one generation to the next. And I think like within white families, it's often a disregard of emotions, a disregard of feeling, like there's like this more of the emotional abuse that's really, really normalized. And I think like culture shapes what's normal, what's not normal. But also I think there's like deep attachment wounds.
Oh my God, yes.
That have been passed from generation to generation to generation and like are part of culture and normalized by culture as well.
Yeah. And, going back to the normalization piece, I think sometimes the undercurrent is not knowing that you have permission to challenge or question what you were taught, right? I even think about like my own mother, like, and how she reared us and how she raised us and how she engaged in punishing tactics. A lot of it is what she learned from her mom, right? And there's no question, there's no challenge around that. And so we just kind of adopt these principles and integrate it in our own family dynamics and with no surveillance of it, right? And I think the work clinically that I do with my clients is, investigating that. Like you have permission to investigate. You have permission to change the course on that. And that's where the hope lies for me.
Yeah, and I think with that is to listen to yourself. Because so much of the time I see with my clients, I will see emotion come up and then they will talk themselves out of it. It's not that big of a deal. It's fine. Like everyone experiences that. People experience worse than me. And so I think so much of the work is like, how do we actually honor our own experience compared to just agreeing that what's normal is healthy? Because I think what's normal is not healthy.
Right.
For the most part.
Yeah. And that to me goes back to like the ACEs, right? The average childhood experience is like, regardless if you think it's normal, you may mentally think that's normal, but what happened to you could literally lead to like chronic illnesses, like alcoholism, hypersexualism, right? All sorts of things. There's a whole host, and it's scientifically proven early exposure can connect to those impairments and functioning later on. And so even kind of integrating some of that psychoeducation to kind of help them come to that realization, because I don't ever want to challenge someone who wants to normalize something, right? You lay out the information, you offer the holding, but giving them the later on, giving them the context of like how that can impact you later on, and letting them kind of come to their own terms or their own sense around like how they want to challenge that. Yeah.
And I think it's hard to sit with the reality.
Yeah.
Right? It's hard to sit with the pain.
Yeah.
Because when you do that, you actually have to change.
Oof.
You know, you actually have to change your life.
Yeah.
You have to examine relationships. And I think what's really challenging in terms of when trauma happens in families is when we are young, we have to idealize our parents in some way because they are what keeps us safe. Like we need them to meet our material safety, and that often comes at the cost of disconnecting from ourselves. And then navigating those relationships as we get older means that if I really connect to myself, then maybe I lose connection with the other people in my life. And it doesn't always happen, but it can.
Sometimes it can.
And it's, even if it's for your best, right? Like it does happen. And so I think it's super challenging to navigate all of that because you have to go through a lot of grief and pain when you look at the reality.
Yeah.
And I think that's why people have to do it in the timeline that works for them.
Yeah. You can have clients who are in therapy for many years for this very reason, right? And that's why you have different like approaches to treatment. You have short-term treatment for folks who like, you know, maybe it's something that they're navigating in the moment, and you may only need therapy for 6 months to a year. But then you have folks who, you know, like you said, you know, it could take a long time to fully come to terms with that. Sometimes clients just need the witnessing. Hey, I went through all of this. I'm noticing it's impacting like how I'm working and how I'm able to connect to my husband or my wife or my partner. Sometimes a holding of that space alone can last 2 years, right? And then once they're integrated and their awareness is developed, it's like, wait a minute, I too still have responsibility? Like, not only was I harmed, not only was I the victim, I still have responsibility to still show up and be a healthy partner or a healthy mother. I still have the responsibility to show up and work every day, right? And that's where you kind of see that crossroad in our clinical work, right? It's like, are they going to progress further? And, you know, now we're focusing on interventions and skills, or it's another crossroad of like, maybe they need another year to just process and like navigate what's coming up for them. Yeah, that responsibility could feel like overwhelming to recognize, you know, and that, keeps you kind of stagnant at times.
Well, like the agency. I think that's like the beauty of doing trauma healing is you get to this place of feeling in control of your life, because often, I mean, personally, I felt out of control for a lot of it. But like getting to that place of feeling in control also means you have all the responsibility of your life, and you have to actually like decide what you're doing, take accountability for your life. And I think it never stops. You know, I've been doing a lot of work for a long time on myself, and I still have experiences where like I feel that like emotional flooding. I feel overwhelmed in a way that I know isn't the same as I should be feeling for whatever's happening in the moment, right? Like I think we can work to process things, and it's a lifelong journey of like unpacking layers and going deeper. But there is like a plateau you get to where things get easier. Yeah. Right? Like it's like, it feels like climbing a mountain at first, I feel like, or maybe going like deep down into a cave.
Down into the cave,
But I feel like there is a place that it gets easier. But I think sometimes there's an unrealistic expectation that therapy just means you feel good all the time. And I think therapy just helps you to feel. Yeah. And like hold whatever you're feeling in a different way.
And I'm glad you offered that context, because when you were saying easier, I'm like, the way I'm digesting easier is like the awareness is there. You can recognize like, hey, this is the inner critic that's connected to the trauma I experienced with this caregiver, or oh, this is like me feeling a sense of self-doubt because of X, Y, and Z. It's like The clinical work allows you to get to that place of understanding why and how you're showing up. And to me, that's how I'm digesting a bit easy. It's like, okay, I have understanding, I have context now.
Yeah, like there's like a foundation of self, of like really knowing yourself, but then it makes it easier to navigate life. And it's just a process that's constantly unfolding, right? Life is a practice.
It is a practice. And I think something that's also important to note is even when you have come to terms with what's coming up or having connections or understanding the roots of your challenges or your traumas, like that doesn't negate the harm that was done. And I think what I see clinically with some clients is like, you see them on the brink of making that progress and having that awareness, right? But it's the fear of, I have responsibility now. And it's the fear of letting go of the harm, like feeling like they need to let go of the harm. I don't want to forgive this person, or this thing happened to me, and if I forgive them and if I move forward with agency, that means I'm allowing that person's harm to like not manifest in the way that, you know, that is harmful. Does that make sense?
Yeah. I, as you were saying that, what I was thinking about is like this internal scaffolding we have, almost like these structures that kept us safe for so long, of like how we think about the world, our beliefs, how we relate to other people. And I work with a lot of people who kind of like take care of other people, and so like giving that structure up feels so overwhelming and scary. And I think that that's part of why change can be scary. It's like you have to tear down the house.
Oh yeah.
Or like I often talk about it like you have like a really messy closet, and you have to like take everything out of the closet and go through it all before it can get organized again. And that's a really scary process.
It's a scary process, and I love that you gave that analogy because it kind of puts what I was trying to conceptualize in like words, but you gave the context, and that's how I kind of see trauma is like someone else ruined your room. Someone else put all of that junk in your room, and now you're sitting with the mess of it all. And the therapy is slowly but surely taking those pieces out of the room, reorganizing, and then like our offering to the client is like it's your responsibility to find the order and how it goes back into the space, right?
Yeah, I love the analogy of people putting stuff there, and what came to my mind was like getting hand-me-downs, to go back to kind of the intergenerational piece of things. It's like everyone just like gives you their old clothes. It's like you're the youngest child.
Oh my God, yes. Oh, I love that.
Everyone's just
here's
like,
my Goodwill bag.
Yeah, everyone's just giving you all their clothes.
And you're like, I didn't ask for this. You're like, well, my mom gave me this sweater. My uncle gave me this rice cooker. You're like, you're dealing with all of this stuff that you didn't ask for.
Yeah.
The news flash, like, sometimes the people who put the stuff there, they didn't ask for it either. And that's how the intergenerational trauma works, right? But we still have responsibility because guess what? The stuff is still in the room. It's still in the room.
Yeah, and I think so much, like, just as we're talking about, I think, like, putting things on other people, I think often what we're talking about is this transmission of shame. So much of trauma is about, like, I can't experience myself or my own feelings, and I'm gonna put it on you.
Oh yeah.
And I think shame is such a big part of trauma, and how that just gets like passed around, and it's like that shadow piece too that I think is often what is hard to go into. Often we have to like touch into that shame.
We do. And like you said, it's the force feeding of the shame, right? Taking on someone else's baggage or taking on what the other person doesn't want to hold. And sometimes that comes from like the people, like you said, who are meant to protect us, digesting their shame, right? And the way that shows up for me with shadow work or depth psychology is the incongruent piece, right? So when you have a client who says they feel a certain way about their body or their image, I'm like, whose voice is that? Is that really yours? Because I remember what you told me is like, when you were a kid, your mom used to body shame herself. She would look at herself in the mirror and judge everything she saw, right? As a child, maybe you're indoctrinating those beliefs into your own, right? And the way it manifests when you get older is it shows up in you, right? But there's something that's off about it. And to me, that's when you do the work around, like, is this integrated or is this disconnected? And you've learned to embody that shame. Yeah.
Yeah, because so much of it is not ours.
Yeah.
And but it also like lives collectively.
Yeah.
You know, I think like shame is how people maintain power. And that can happen within our families. It happens in society too. That is, I mean, even if you just look at Trump.
Oh Lord.
You know, not to like go over for that long, but I feel like that is what happens within families too. That there's someone who wants to maintain their power at top, and then they just project everything they don't want to feel or look at within themselves onto everyone else in the family.
And the way that can impact the people they're projecting it on is that sense of powerlessness or the embodiment of the shame themselves, right? And then what happens? Like, we're emotionally depleted, we're feeling physically depleted, and no one challenges the system anymore because we've all embodied that shame, even though it's not ours to begin with. But it goes back to the analogy of the junk in the room. Eventually you start to feel powerless.
And I think that going back to the junk in the room, so many of my clients feel like it's their fault. They're messy, right? Like, they're messy. They can't do it. They can't keep themselves. Like, it's like turns into like, it's my fault.
Yeah.
And it's sometimes it's my fault this happened, but I think more often it shows up in like, it's my fault that my life is the way it is. And then it's hard to navigate that in a way of like going back to accountability, right? Where it's like there is part of it is accountability, but I think so much of it is like giving stuff back to other people that like that is part of the work. And it's not taking accountability for all the shit people left in your house.
Yeah, it's like murky waters, right? Because like a part of it isn't their fault. If you're 4 years old and that harm that was caused to you at that age was done to you, the bag is still in your room, but it's not your fault that it's in your room because you were powerless, you were young, you were a little baby, or you know what I mean? But as you become an adult and you still have that bag in your room, that's where the accountability piece is. So I think it's like it's a delicate dance to kind of share that, because essentially to start it wasn't their fault. So how do you navigate that for your clients who are like sitting with that of like, this wasn't my fault, and now I'm stuck with all this trash, I'm stuck with all this mess that I have responsibility to shift and change when it wasn't mine to begin with? Yeah, how do you? I feel like that's murky waters.
Well, I think first just being able to let them know that it's not their fault, that it's there, right? Because I think what happens is shame is often associated when we're in this shutdown state of our nervous system, and we get really immobilized by shame. So if we feel like it's our fault that trash is in our room,
right?
We feel like we deserve the trash. We deserve the trash to be in our room, so I'm not worthy of putting time and energy into myself or cleaning up my room.
I deserve for that trash to be in my room. This is just what it is. It's mine.
Right, and I think that can be very, like, we get stuck in that, right? So I think there's a piece of being able to like sort through what's there, like starting just with what's there.
Yeah.
And being able to see, like, is this mine? Is this not mine? And I think sometimes if we work really somatically, there's a different felt sense of this is my emotion compared to this is someone else's emotion.
Yeah. When I hear those comments in session too of like, no, like I'm a shitty partner, or I deserve to be treated this way. Like, do you really believe that? Because if it feels like this is intrinsically true for me, I'm aligned to that statement, that's your shit, right? But if there's something that's off or amiss, we can work with that, because that goes back to, this is not congruent. This isn't yours. Right?
Well, because I think we all have multiple parts too, right? Where I know at one point in my life, I was very much like, I deserve all the trash in my room. I don't deserve to pick it up, you know? But there was always a part of me that didn't believe that.
Mm-hmm.
And it's just like, how do we pull that part out that knows that you deserve more than that? And make that voice maybe a little bit louder than the voice that says you do deserve it.
I created like a little exercise, right? I call it policing your thoughts, right? It's like literally I want you to put on a police cap and like pull up on that thought and be like, wait, what's going on here? Like, where did this come from? When I worked with Rachel or when I worked with Shanisha, you know, they helped me recognize that this isn't congruent. This isn't my truth, right? And you counter that with something as simple as daily affirmations, right? In the same ways that we've adopted these beliefs, we use that same formula to unlearn those beliefs, right? But in order to unlearn, you have to digest some new information. You have to input new information. Going back to the junk in the room, right? You're getting that Goodwill bag that your great-great-grandma passed on to you. We got to do some new shopping. We got to refresh the wardrobe, right? And that's essentially what it is.
Yeah, and I think with that is, sometimes I will talk to my clients about if we're in a relationship with another person, like we can say we love them all day, but if we're not acting in a way that shows them we love them, it doesn't really mean we love them, right? Like it's an active practice to love someone. I think that's true for ourselves too, even if we don't believe it yet, right? Like sometimes it's actually like, I'm just gonna do these things that care for myself, and that is what then helps us to embody the feeling of caring for ourselves, of being worthy. But I think sometimes there's this, but I want someone else to do it. I like when you didn't get that in your family, there's like a piece of you that really needs a lot of like TLC, because it's like, I shouldn't have to do this. I've had to do this my whole life. Like I want someone else
to do it.
Which is, you know, I think also part of the work is, how do we relate to other people and actually let someone in and be able to receive that?
It goes back to the responsibility of like self-care, right? Self-care. It's like thinking about, you know, the indoctrinated beliefs, taking on the shame, taking on what's not ours. Someone else have kind of done that, kind of convincing us that we don't have agency. So the way to undo that is like, no one else is going to still show up and give you the care that you need. You have to take that step, and that goes back to the responsibility of caring for yourself. And I think that's where that term "fake it till you make it" came from, right? It's like sometimes we don't have all the resources in the moment. You have to do what you can in the moment to try to convince yourself, right? And I think that's a part of like what daily affirmations are for folks, right? It's like, you may not believe the affirmations in the moment, but every day eventually it's going to snag onto something. And that's our responsibility.
Yeah, and like daily practice. Obviously, you know, as a yoga therapist, like I have a very strong daily practice, and I often work with my clients to find daily practices, because I think there's something so powerful. If it's affirmations, if it's yoga, breath work, whatever, if you are taking time, even if it's 2 minutes a day, and you're saying, I am important enough to do something for myself in these 2 minutes, could be longer than that, right? But like, I think that in itself is starting to shift, and doing those things, it's over time is like a slow shift, right? Like I think I have some clients who want this like huge cathartic, everything shifts in 1 minute, but that's just not how change works. That's not how change works. You know, it's like something happens and you respond a little differently, or you don't have the same big reaction that you did. Like I think there's like a beauty in watching someone realize that like they've just changed and they didn't even know it.
Yeah, it's a gradual progression over time, like going to the gym, right? Some folks are in the gym for about a year before they see any progress, but what they don't know is happening behind the scenes is like body recomposition. So it shows up in like, oh, I got a little gain here, I got a little gain here, I'm making healthier decisions. That's how change works clinically as well. It's like, you're going to stumble, right? Some days you're going to have cheat days, and I see cheat days as like, there's going to be days you may crash out or be frustrated, or you're not your most ideal self, or you may want to rot in your bed for a week because life is just too hard. But it's like getting back on course, getting back on your regimen, right? And eventually it sticks. And then you look up a year in and you're like, wow, like I'm taking responsibility. I'm taking ownership. Yeah.
Yeah, and I think there's a beauty of, like, as you were saying that, just that you have to be awkward. You know, as like a dancer, I was really bad at dancing when I started.
Yeah.
You know, and that I'm gonna do this, and it's gonna be awkward and weird, and it's gonna feel like I have to really work hard at it before it like gets in your body. And I think healing trauma is a lot like that. That it's just like you have to be okay with looking stupid or like trying new things and
being a little sloppy, messing up along the journey, and now look at you doing headstands. But yeah, I love these analogies, and I try to integrate those into my clinical practice as well to kind of contextualize it. You know, like if you're looking at it from one linear direction, you can see a lot of fault in that. But when you think about it from I like that analogy around dance because that makes sense, right?
Yeah, I wonder if we want to just end on kind of maybe what we see like on the other side of the tunnel, if it's like personally or what we've witnessed, why all that mess and taking the trash out and everything is worth it.
Why is it worth it? What's on the other side? Ignorance is bliss. What you don't know, I think to some degree is like this false sense of like joy and adoration about life. And like, okay, I don't have to think. I can kind of like enjoy the world with my eyes closed. And I think being on the other side of the tunnel with this trauma work and doing the work involves like you seeing what's beneath the surface, right? And every day as I'm working on becoming more and more self-actualized in my own journey, it's like recognizing what's beneath the surface, understanding what drives my anger, understanding what drives my irritability and my frustrations. Sometimes I don't say the nicest things. I'm human, right? In my relationship dynamics, I'm like, oh, that was interesting. I shouldn't have did that thing. But the light at the end of the tunnel is giving me context as to why I did what I did. And the light at the end of the tunnel is also showing me the pathway that I can take to repair, right? And that's not, like somebody else can look at that and say, that's not the light at the end of the tunnel. That's that's a bit much. But for me, it's the awareness that gives me the responsibility to know, okay, I have responsibility and I know how to be better.
Yeah, I think for me there's choice.
Yeah.
Right? I think that that's like a big thing that's on the other side of the tunnel. Is choice over how you live your life.
Yeah.
And in like real intimacy, both with yourself and other people.
Oh yeah.
You know, like I think I didn't know how to like be really intimate with anyone for a lot of my life. And I never really felt seen or understood. And doing the work allows me to actually be really deeply seen and connected. And it's hard.
Yeah.
You know, like it isn't like I'm just like happy all the time. That's for sure not realistic. But I think I feel congruent. I feel like I have integrity. And I feel like I can actually make choices that my behaviors align with my values.
Oh yeah. Yeah, there's a certain level of freedom in that too, of recognizing like your responsibility and showing up for your friends and showing up for the folks around you, and recognizing that you still have choice in like repair, right? Too in that.
And I think just like freedom. There's freedom to be yourself. You know, I feel like there's like a lightness that I have, like just like I can move more freely in the world, like physically, but metaphorically as well.
Yeah. Just show up as your authentic self. You don't have to be someone you're not. You don't have to be this fragmented part of yourself that you've learned to like be for the purposes of survival. I don't have to sound like you. I don't have to talk like this person. I can just truly be myself and trust that like I will be loved for that. And I know I will be loved for that because I love myself and I've learned to love myself. All of the murky parts of me. Yeah.
And like I know I have me, even if other people don't. even if like whatever's happening outside is overwhelming, like I know I have me.
Mm-hmm.
And for me, I think part of that practice is also like a surrender that like something greater has me to you, like the spiritual piece of it.
Mm-hmm. That's the beauty of therapy. Learning how to have yourself. When you said I have me, I'm like, oh my God, that's so powerful. And I think that's a part of like the inner child trauma work is teaching clients how to have themselves, how to be their own safe container when they don't even have a point of reference to go off of. Developing that for themselves.
Yeah, it's beautiful.
Yeah.